Hello and welcome to this week's edition of News in Depth. My name is Onechi on ZNBC TV-1, your public service broadcaster. Now, Zambia first recorded cases of COVID-19 on the 18th of March 2020. Although the country endured the first wave of COVID-19 with significant change in people's lives, the country has been struck by the second wave of the pandemic, which is more transmissible with symptoms that are more severe, triggering a rise in the death toll. In this particular edition of News in Depth, FM Pande looks at the nature of the second wave, government's interventions, and what people need to do to survive this crisis.
COVID-19 is back with full force. The infections are rising at an alarming rate. On a daily basis, the country is recording new infections and deaths. The second wave of the new severe acute respiratory syndrome, coronavirus 2, SARS-CoV-2, is virulent and stronger than the first one. Experts say the new variant of the virus is fast spreading.
A variant is, in a simple way, I would say it's a virus which has become slightly different from the original virus that was known. So it hasn't changed much, but it has drifted a little bit from the original virus that was known. So in that case, we would refer to that as a variant. So it's just a variation of the original virus. As the virus keeps changing its nature, it goes through different stages, which we have given some definition so that we all agree on, we understand when we refer to a strain or a virus, of a virus or a variant. So if it changes a little bit, you would call it a variant. If it changes a little bit more, it becomes a strain. And if it changes a little bit more, it becomes another species, or it becomes another genus or another family.
SARS-CoV-2 has about 30,000 pieces of DNA. But what happened to the original virus?
We wouldn't know exactly what happened to the original virus, but what we know is that what we strongly believe is that the new variant that we have now seems to be more common than the other one. The other one could be there, but maybe we are not detecting it because of the lower numbers.
How different is the new variant from the previous one in the first wave?
Our Unzavet lab, we tested close to about 10,000 samples. We only had maybe 1 or 2 positives. So we're very sure that we had no SARS-CoV-2 anymore. But then towards the end of November, beginning of December, we just started noticing positives start popping up. And then I think there was a suggestion that there appears to be more cases than the original infections that we had last year. And then we developed interest in finding out what really exactly is different about these cases. And then that's when we, I think through ZNPHI and Ministry of Health, formed a consortium where we started sequencing, looking at the nature of the DNA of the viruses. And when we looked at some of these viruses that we have now from the second wave, we realized that they are quite different from the original viruses.
And the difference again we are seeing in the second wave is that unlike with the first wave, where we saw majority of the people asymptomatic, they test positive and generally well, where we saw those who were admitted, the few are those who had comorbidities, other illnesses, and those who were elderly. This variant is hitting across the board, and the majority we have right now in our treatment centers are the youth, the productive group. The majority are in the range between 15 years and 50. And you find that they don't have comorbidities. So these are very healthy young men, and then they are hit.
COVID-19 is on the loose. How widespread is the new variant?
The genomic sequencing we have done so far, we have picked it in the routine testing in the community. We have picked it in the testing we're doing in the hospitals. We have picked it in the truck drivers. So basically it's quite widespread. We are still doing quite a lot of studies trying to characterize the virus we are dealing with in the country. But just to say that it's quite widespread.
Onechi, just like many other Zambians, is one of those that did not mind socializing during the festive season. He attended a number of corporate events and frequented nightclubs. But it wasn't long before he got infected with COVID-19. On the eve of New Year, Onechi was admitted to the University Teaching Hospital's intensive care unit.
I developed a cough early in December. I just ignored it, didn't think much of it, carried on with my socializing. And I actually remember there was one point I walked into a nightclub, and I remember looking at the mass of people present, and not one single person was wearing a mask. Not one single person. I can't really say where exactly I got it from. I did frequent a number of places like other people who were all socializing and enjoying the end of year. And then next thing I know, the cough is getting much worse. And then I started to present some other symptoms. And I went to UTH to be tested, and I received the call the following day to say that you are positive. And at this point, even my breathing now, it was difficult to breathe. And thank goodness that very day, when I found out that I was positive, I went to the hospital and I was admitted. I didn't even realize it then, but I did need the oxygen. And I never imagined that on New Year's Eve, I would be on oxygen in the ICU isolation ward at UTH.
Onechi spent 1 week in the intensive care unit.
It was a terrible experience. Really, really terrible, terrifying. If it wasn't, you wonder if you'll see loved ones ever again. These thoughts cross your mind, and just also being there, being so ill. The doctors actually are quite excellent at UTH, and I feel like the staff, they are quite overworked because the ward was full, and even the nurses, they had so much work to do, but I think they tried their best. So I'm quite grateful to the doctors and the team at UTH.
But not everyone has been this lucky. Some have not come out alive of the Levi Mwanawasa Teaching Hospital Isolation Center for COVID-19. Motinta Shisholeka's brother died in July last year. Her brother was patient number 63.
I had hope. I had lots of hope. Okay? When I'm talking to him, his voice projection was rather good. Yes, he would have his moments where he had to take a breath, but I had seen worse, and they had pulled through. You see? So I did not think my brother was going to die.
Mutinta is a biomedical scientist and the head of the COVID Center laboratory, but even with her medical background, there were a number of times she felt helpless.
It was a very difficult process, actually. Knowing that my brother is a few meters from where I am, but I can't go. That was very difficult. The hardness comes in the fact that you feel inadequate, like very inadequate, because your person is there, they are alone, and they're alone. You see? Yes, your colleagues are there, but they've got other people also to look after your person. But you yourself can't go.
In recent weeks, Zambia has seen an increase in the number of hospital admissions. The country has also seen a rise in the number of deaths at health facilities and in the community.
We have provided what is needed, both in terms of the oxygen, the supplies, the PPEs. They are equipped, we can manage. But of course, being careful here in what I'm saying, that if we get overwhelmed, of course we'll be challenged. For now, yes, we are managing, but if the numbers grow, we'll be challenged. We'll not cope.
Inside a COVID-19 isolation facility, things are very different. For medical staff, working in here can be tiring, both mentally and physically. But for patients, it's the uncertainty that takes a toll on them.
I never thought that I myself would go through that. It seemed like something so distant, something that you just never think about. And next thing you know, you're in the isolation ward. And it was interesting because while we were in isolation, you know, you would hear about friends maybe also being in the same building, or maybe friends at Levy, and you just wake up one day and there's a text message, or that friend has passed on. You know, and every single day, I think, on average, every second day I'm getting a message that a friend, a colleague, acquaintance, an associate has passed on from COVID.
But outside, not everyone is taking the virulent COVID-19 variant seriously.
Their non-adherence to the health guidelines, I would basically attribute it to a psychological phenomena, which we call habituation. You know, when you're exposed to a particular stimulus over time, you basically become non-compliant towards it. You know, you become complacent, you become reluctant. And it could very efficiently be explained through psychological theories. What happens is when our brain at first encounters a new stimulus, it records it, it creates a model, and every time after that model is created, it's exposed to that particular stimulus, it begins to compare, you know. So the first time we heard about COVID, there was high alert. But over a period of like these 9-10 months that we have been hearing about it and seeing it, our brain basically reduces the intensity of the response that we elicit or we show.
There is quite a lot of actually incorrect information that is being posted everywhere, particularly on social media. I think it's a big challenge. And I think to a large extent that has brought some confusion in terms of people sifting through on what is basically the correct information and what actually is just rumor and conspiracy theories. So I think there's quite a lot of conspiracy theories around around COVID-19, and that has created quite a lot of noise in courts in terms of actually really people being able to actually really see the seriousness of the issue.
But what can be done to make everyone adhere to health guidelines on COVID-19?
Literally everything now boils down to individual level. You know, your own commitment to your protecting your health and the health of your loved ones. It's like, you know, you need to learn to prioritize now. Is it I get an invitation to a party, or I get an invitation to a wedding? Me as an individual, I have to evaluate to see whether going to the party is more important or taking care of my health and the 2 little children that I have, taking care of their health and protecting them against this pandemic.
One thing we have to do is to sort out the issue of infodemics. There's quite a lot of rumor mongering, a lot of false information going around, a lot of conspiracy theories. And I think we need to actually find a way of sorting out, of course, within the democratic space. And I think there are quite some good cases on how you can do that from other countries. So I think we need to actually really maybe, for example, come up with counter messages. And I've seen government is already trying to do that with the designated authorities to try to actually really take head on some of the things that are circulating that are false. So I think we need to do more a bit. And they really, particularly on social media, it's quite a challenge, and they probably need to find a way of engaging the different people running different social media spaces, including engaging admins of popular social media spaces. They need to actually really get engaged on what COVID is and its seriousness.
Zambia first reported COVID-19 cases on 18th March 2020. Since then, the country has recorded over 40,000 cumulative cases of COVID-19. And the director of the Zambia National Public Health Institute says it is essential that Zambians act now and stop the spread of COVID-19.
We are at a crossroads now. We can decide our destiny. We don't adhere to, as you can see already, it's evolving. The numbers will increase, a lot of people will get sick, and a lot of people will die. And I'm sure you have seen some of the catastrophic effects it has had in the developed countries, where they have the resources and they have manpower. So what more on our side? One is that we'll lose a lot of people. Our healthcare delivery system will get overwhelmed. It will cripple our economy because nobody will be able to go for work. Economically, will not be productive.
The University of Zambia School of Veterinary Medicine has been testing for COVID-19 since January 2020. The ONZA laboratory has so far conducted 78,000 tests.
When people go for contact tracing, looking for people who have been in touch with people who are infected, we have noticed there's a trend where you have more people being positive because they came in contact with someone who has the virus. So there's a very strong suggestion that this virus is quite transmissible. We all need to mask up. We all need to take care of ourselves. It doesn't matter who they are, whether they are friends and family members. We all have to mask up at every opportunity that we get.
Despite the rising number of COVID-19 cases, many go about their business every day without putting on a face mask or keeping a physical distance. After surviving the disease, Onechi now advocates even more strongly for people to protect themselves against COVID-19.
It's also given me like a greater appreciation for life. It's also changed my perspective, having been through that harrowing experience. And so I'm indulging my passions a bit more, and also, like I mentioned, trying to use whatever small platforms I have to get the word out that COVID is real and that we need to do everything in our individual capacities to fight it. And every person out there needs to take it absolutely seriously. Mask up, sanitize, distance, do your part, protect your loved ones, protect yourself.
The symptoms for COVID-19 include a dry cough, fever, tiredness, chest pain, and difficult breathing. And a medical expert says people should not ignore the symptoms.
My biggest regret in this whole thing is not pushing my brother hard enough to go to the hospital when I saw the signs. When people see signs of COVID, get assessed immediately. I would rather have a brother who hates me for pushing him and for going beyond his space and getting him to a hospital and he's alive today than my brother who's died now.
Human behavior is the major factor in causing a spike in coronavirus cases, and experts are calling on individuals to do more in curbing the spread.
Let us get on with our lives. We have to manage it, but then please do adhere to the health guidelines. It's not just about you, it's about your loved ones, it's about the community that you're living in, it's about the society that you're living in, it's about the world that we are living in.
I'm just appealing to people to say COVID is real, and let's follow the recommended guidelines prescribed by health experts. Of course, mostly we are talking about guidelines that are based on science. So I think people really, we need to work together, and the government can do everything. I think there's a lot that communities and different sectors can do, and if people have support funds in any way they can do, I think they can actually go down to different sectors to try to support government effort.
COVID is with us, And the new variant we're dealing with is very virulent, very aggressive. The only way we can stop it is prevention. Prevention is better than cure. The ammunition to stop it is with us, and appealing the public, every responsible citizen, to adhere to the golden rules, the 5 golden rules, and adhere to the public health measures.
Until everyone does their part by wearing face masks, regularly washing their hands with water and soap, and keeping a distance, Zambia may be far from curbing the spread of COVID-19.
Well, that is all we had for you in today's edition of News in Depth, where Efim Pande was looking at the nature of the second wave of COVID-19, government's interventions, and what people need to do to survive this crisis. My name is Onechi. Thank you for watching.